Awesome. All right. Well, thank you for being here today, Andrew. My name is Mike Anderson. I am the owner of Anderson Benefit Partners and I guess the runner of the Insurance People podcast here. Goal of our podcast, Andrew, is to help business owners, HR people, CFOs, other agents and brokers find the right carrier partners and insurance products to serve either clients or their teams. So I'm going to give you some time here to introduce yourself. I'm looking forward to having you. So Andrew, take it away. Tell us about Kavira Health, who you are and Kavira Health.
Awesome. Yeah. Well, thanks so much for having me, Mike. As you mentioned, my name's Andrew Headrick. I'm the founder and CEO of Kavira Health. I grew up locally in the western suburbs of Minneapolis. I grew up in a large family with quadruple younger siblings, which meant I spent ample time in primary care clinics and waiting rooms during my younger years, which plays a huge role in why I started the company. I attended Middlebury College in Vermont, where I studied economics and Chinese. I've held various roles professionally, locally here at Medtronic, at a local hedge fund, and most recently at Piper Sandler, which is an investment bank, where I completed 13 healthcare transactions worth over $4.3 billion. It was really during my time at Piper that I realized just how badly the healthcare system needed an upgrade. And that's why I started Kavira. I started Kavira nearly 2 years ago in an effort to make everyday healthcare more convenient, more cost-effective, and more accessible to all. And I'm really proud to say that we've been doing just that. Over the past year, we have had thousands of patient interactions with a 9 out of 10 patient rating, which is really incredible for the industry. Our patients have never had to pay a copay, nor have our patients ever had to leave their homes to receive care. So we actually go into the home to provide all of our care. So that's a little bit about my background.
That's awesome. Would you mind, Andrew, tell me a little bit more about how Kavira is delivered to maybe a member or somebody that's using Kavira?
Yeah, well, at our core, Kavira is a subscription-based primary and urgent care clinic that delivers all care via telehealth and at-home visits. The subscription is typically paid for by an employer, and in turn, employees and their families receive unlimited, on-demand, completely free access to our service. You can think of us a little bit like everyday care coverage for your everyday healthcare needs. The way that it works is every visit starts with a patient reaching out to us through our online or mobile app. Through the app, we can diagnose and prescribe. I think we've all realized just how powerful telehealth really can be over the last couple of years. My favorite part about this is because the care is fully paid for by that monthly subscription fee, there's no cost associated with reaching out to us. So patients can and do reach out to us for any and every little ailment. It's kind of like you have a provider in your pocket at all times that you can reach out to whenever you need anything. And then the really unique part about Kavira is if and when in-person care is needed, we're actually going to send that clinician to your home and provide care in the living room. So you don't have to worry about figuring out who's in network, who's nearby, who's accepting new patients. You don't have to take the afternoon off of work and drive across town and sit in that stuffy germ-filled waiting room, because we're actually going to come to your home and deliver care in the living room.
Man, I think that is absolutely outstanding, and what an amazing benefit for an employer to offer their team, regardless of their health plan, right? So even if they have a health plan, in our market today, employees have huge deductibles. There's always out-of-pocket cost sharing. So to provide that first dollar coverage for services, if I'm tracking with you, that an employee might go to their primary care or the Minute Clinic for, or maybe urgent care, to have that first dollar coverage where there's no cost sharing is a major benefit.
Yeah, exactly right. There are a few types of clients that we make a lot of sense for. One is companies that don't offer any health insurance today because health insurance is too expensive. Those companies can and do offer Kavira to their employees to provide a really cost-effective, highly visible, unique, amazing employee benefit that saves their employees money on those everyday healthcare needs. The second, which you touched on, is companies that offer high deductible health plans. High deductibles are amazing because they lower premiums and they can provide a great tax shelter, especially when paired with HSAs. But to your point, they also shift the burden of those everyday nickel and dime expenses onto individuals. And those costs can really add up. The average American is spending over $600 out of pocket every single year to simply cover their everyday healthcare expenses. So these are people who already have health insurance. They're still paying a crazy amount of money to just cover, manage and maintain their everyday healthcare needs. For a family of four, that's $2,400 out of pocket every year. And for a family of seven, like mine, that's $4,200 out of pocket every single year to simply manage and maintain everyday health. And so that's a huge problem. I would say that health insurance is great in a lot of ways, but I think that what we do is we kind of supercharge those high deductible health plans, and we help employers to help their employees save money and provide more convenient everyday healthcare.
Right. Oh, I love it. I think it's absolutely fantastic. So I always like to ask our guests, what do you think your biggest strength at Kavira is, and maybe what is the biggest weakness?
Yeah, good question. I got to say our biggest strength is both our business model and our team. So we have a lot of really happy clients, both employers and employees. And I think that's because when you remove the copays, the insurance hassles, the surprise bills, and you provide that really responsive care in the living room, people really do love the service. It's just such an upgrade from the traditional system that we're used to that's filled with confusion and expenses. In terms of our biggest weakness, I guess I'll pull a little bit of a Michael Scott here and say our biggest weakness is also one of our biggest strengths. We're a startup and we're still learning every day, but that also means that we can be really flexible and responsive to our clients, and it means that our service is constantly improving. So, for instance, we've had a number of conversations with clients. Behavioral health is a huge need right now. It comes as no surprise to anyone. But because of that, it's looking like we'll roll out a behavioral health benefit in the next month or so, which will help us provide better care for our members. And I think that's just an example of how, being a startup, we're able to move quickly and really service our clients in ways that works for them.
It's awesome. And I love it that you use a Michael Scott quote, because I have Michael Scott and Dwight Schrute on my office wall. So that's fantastic.
I love it. Yeah, I'm a big fan.
Me too. So Andrew, I'm going to have you just recap here for me. What do you think is the biggest problem in the healthcare or employee benefit market that you serve, and how do you solve that problem? Yeah,
so there's a lot of ways I could go with this, but I think where I come at this from is that primary care is so important. It is the only discipline in medicine that reliably can improve health outcomes, lower costs, and lengthen life expectancy. The issue is that over the last 2 decades, people have been consuming less and less primary care. Instead, we're just going straight to the specialist whenever an issue arises. And so we're being more reactive than proactive. And that's a big problem. We're just to summarize that, we've been losing that relationship with our providers, which is so important. And so what we're working on at Kavira is reestablishing that provider-patient relationship that so many of us have lost over the last 2 decades. And the hope is that if we're able to reestablish that provider-patient relationship, then we'll have healthier, happier people, and we're going to be able to drive down costs in the process.
Man, it's awesome. Well, I am very appreciative of our relationship, and you're doing great things for the Minneapolis and Minnesota healthcare market and employee benefits. I mean, it's a, innovation needs to happen, as I think everybody would agree that has health insurance, right? I mean, the system might be broken, and I think you and Kavira are helping us fix the problem. So that's awesome. So I'm going to wrap up here, Andrew, with your favorite motivational quote. Lay it on us.
Well, thanks so much for those kind words, Mike. I really appreciate it. It's been great working with you over the last 2 years as we've gotten Kavira up and running. I would say one of my favorite motivational quotes is, "While we wait for life, life passes." And it's I think you can look at that and it's a little scary, but it is also one of my motivations for reminding me to make the most of today. I think it can either be scary, but it can also be inviting to remember that we got to make the most of what we have here.
I love it. Thanks, man. Happy Friday.
Thanks so much, Mike.
All right. Bye-bye.